I almost punched my first therapist in the face. He was that bad. If you're a guy who's thought therapy isn't for you, or you tried it and it didn't go well, you're not alone. I'm no different, and most guys I talk to that go into therapy haven't had the best experience on their first run through it. And today I want to talk about how to find the right therapist and how to get in sooner so that you can become the man you want to be. Hi, my name's Tim Wienecke. I'm a licensed mental health clinician with over 10 years of experience helping men, veterans, and first responders build lives worth living. First and foremost, most guys with problems aren't willing to go to therapy. 42% of men with a diagnosed mental health condition don't go to therapy. And a lot of it's because my field has not done a good job of prioritizing men's treatment, men's issues, or getting male clinicians. 4 to 5 clinicians are women. We need more help in helping you guys. That said, there are a lot of great clinicians out there that can help you, man, women, and other. Don't think for a minute just because there's a woman that she's not going to be able to help you. However, you need to make sure she's a woman that knows how to talk to a man about what he's going through. So how do you do that? First, don't go into a session blind. Take some time to pick who you want to go with. Doesn't matter what database you want to use, Psychology Today, your insurance, whatever. Try to get on the phone and do a phone screen with you and the intended therapist. It only takes about 15 minutes. What you're looking for is vibe. Do you feel like you can respect them? Do you feel like you can understand them? And do you feel like they respect and understand you? I want you to do that with at least 2 different therapists, so you're picking one, ideally 3. That's going to give you the best shot possible of getting in with somebody who speaks your language and is ready to help you. It's so important for that. So many guys go in and they end up with a therapist that start with how you're feeling and getting to know you. And while that's a key part of clinical work and us building the rapport and me getting the knowledge I need to help you, guys usually need something to do. So find a therapist that, like me, will send you home on your first session with something to try that's going to make your life just a little bit better. Secondarily, stop waiting until your life is a bonfire to go get help. I see it every week. I wasn't all that different. Most guys come in and their wife maybe left them, maybe they lost their job, maybe they had a panic attack in the middle of a job site or a presentation. They wait until it's that bad because their experience has been that they're not supposed to come in. Most guys are raised that if you can just suffer through it and put your head down and work, your life will get better. And that's an important value. Grit matters, but you can do it smarter. And that's where therapy is going to come in. Get in sooner. Don't be surprised if the first therapist or 2 that you work with don't fit the bill. Don't get discouraged. If you go in and you give them 3 sessions and you're just not feeling it, doesn't feel like it's helping, go ahead and call it, take a break, maybe a week, maybe 2, but not more than that, and get back in with another therapist until you find the right one. I promise you, with the right help, your life gets exponentially better. And it's so wonderful when guys show up before the bonfire, because then we don't have to spend weeks or months just firefighting, just getting them the skills and tools they need to start building a life that's stable enough to even think about who they want to be and how they want to be that person. Start earlier. Start treating this like car maintenance. If you get in for an oil change early, you don't blow the engine. Please, guys, do better. Get in sooner. And don't be afraid to screen therapists and walk away from the ones that don't fit for you. I'm not even saying that the ones that don't fit for you are bad therapists. It's just that not every therapist is the right fit for every patient, and that's okay. It's okay for you to have needs and you to have a therapist that hears you in front of you. It's okay that that therapist specializes in somebody other than you. Look for somebody who can help you. If you want more tips on how to find a therapist, just leave a comment, ask some questions. I'm more than happy to answer them here. I'm working on a more detailed guide on how to find a therapist. When I have that, I'll link it up here. But in the meantime, get out there, get the help you deserve, and start being the man you want to be. I promise you, with the right help, you're going to be surprised how good your life gets. Take care.